I'm Dr. Masuma Hussain. I'm going to discuss with you about polycystic ovarian syndrome. In short, it is called PCOS. First of all, let me tell you what is polycystic ovarian syndrome. Polycystic ovarian syndrome is a common endocrine disorder among women of reproductive age group with enlarged ovaries that contains small collections of fluid called follicles located in each ovaries as seen in ultrasound exam. Signs and symptoms of polycystic ovarian syndrome often begin soon after a woman first begins her periods. In some cases, PCOS develops later during her reproductive periods, and in some, in response to substantial weight gain. Now, what are the symptoms you have? First of all, irregular periods. You have menstrual cycle for more than 35 days or even longer. If you have fewer than 8 menstrual periods a year, or you don't have periods for 4 months or even longer than that, and the prolonged periods may be scanty or heavy. Another symptoms is excess production of androgen. Now, what is androgen? Androgen is excess male hormones, and if there is excess of male hormones, it can lead to production of physical signs like excess of hair growth on your face, on your body, hair growth, acne, male patterns of baldness, etc. Now, what are the factors which play a great role in polycystic ovarian syndrome? Excess production of insulin. Insulin is a hormone we all know secreted from pancreas, allows cells to use sugars. When you have insulin resistance, your ability to use insulin is impaired. As a result, pancreas has to secrete more and more insulin to make glucose available to cells. Now, excess of this insulin may affect the ovaries by increasing androgen production. Which indirectly interferes with the ability of the ovaries to ovulate. Now, as a result, it leads to infertility. Low grade of inflammation may also be seen in some cases where women having PCOS. Heredity also plays a role in having PCOS. Women who have their mothers or sisters with PCOS can develop this syndrome too. Some of the researchers has found that certain genes are linked with PCOS, and that plays the role of transformation from heredity to heredity, and PCOS thus affected the woman. Now, if you don't treat properly, this PCOS can end up with certain complications like diabetes, high blood pressure, cholesterol, lipid abnormalities, which otherwise in other hand may affect the cardiovascular disease. You can have non-alcoholic steatohepatosis, which is a severe liver inflammation. There can be sleep apnea, depression, and even anxiety. Women also develop infertility, abnormal growth, abnormal uterine bleeding, even it leads to cancer of the uterine wall also. Now, so far we have went through the complications. What is PCOS? What are the signs and symptoms? Now, how to diagnose the PCOS? First of all, your doctor will rule out the certain signs like whether you are gaining weight too rapidly in ratio of your height or not, measure blood pressure, examine pelvic organ visually as well as manually to find out any abnormal growth. Apart from this test, you also need to do certain tests. What are those tests? First of all, you have to go for a blood test. Blood test is necessary to check the cholesterol and the triglycerides level, GTT, that is the glucose tolerance test. Glucose tolerant taste, that is you can go for fasting blood sugar or the blood sugar after having a certain amount of sugar, okay, that is PP, postprandial blood sugar. And ultrasonography you can also have, from where you can find the mass or the cyst which develops in ovaries. Now, how to diagnose the PCOS? First of all, your doctor will rule out the certain signs, like whether you are gaining weight too rapidly in ratio of your height or not, measure blood pressure, examine pelvic organ visually as well as manually to find out any abnormal growth. Apart from this test, you also need to do certain tests. What are those tests? First of all, you have to go for a blood test. Blood test is necessary to check the cholesterol and the triglycerides level, GTT, that is the glucose tolerance test. Glucose tolerant test, that is you can go for fasting blood sugar or the blood sugar after having a certain amount of sugar, okay, that is PP, postprandial blood sugar. And ultrasonography you can also have, from where you can find the mass or the cyst which develops in ovaries. Now let me tell you what are the necessary actions you may need to take when you have polycystic ovarian syndrome. For women who are obese, should maintain their weight by having low calorie diet. You should limit your carbohydrates from your diet, like you should stop eating ice creams, fast food, because these are very bad, very much affect the weight of your child, of girls of these days. And to meet weight loss goals, want to visit your dietitian regularly. So you can also do some exercises which can help you control the weight. Go for routine checkup of your blood pressure and blood sugar. PCOS is not that harmful, I must say. It's not that deadly disorder, I must say. So if ladies who have suffered from this disease, please go for treatment as soon as possible before it becomes complicated cases. I want to tell all the ladies who are suffering from this disease not to panic, not to worry, as I have already discussed what are the actions you need to take. So I'm sure you will do so and soon recover also, and so stay healthy also. By this I'm ending this discussion. Thank you.